Millions of needy people in the United States receive assistance through government-funded programs every year. One of these programs is the Medicaid program, now serving over 70 million people annually after the enactment of the Affordable Care Act. This presentation will firstly discuss a brief history of the Medicaid program and Medicaid expansions after the Affordable Care Act. And secondly, it will discuss one of the main problems that can arise if the program is not maintained properly. Finally, the importance of two primary bioethical principles regarding the Medicaid program will be discussed. The Medicaid program was founded in 1965 and serves a myriad of people, including families, children, the disabled, pregnant women, and low-income individuals. Medicaid is a joint program funded by the federal government in conjunction with the state. While the federal government has established certain guidelines to govern the Medicaid program, each state implements the program in a different way. Thus, the state of Idaho implements the Medicaid program in a different way than the state of California, while adhering to certain guidelines and the crux of the program itself. Practically speaking, the Medicaid program is funded by taxpayer dollars at a state and federal level. Taxpayers pay a certain percent of their income into the Medicaid program, which is then funded by the state and matched by the federal government. The money allotted into this program is then used to reimburse healthcare providers such as physicians and nursing homes for the services that they provide to Medicaid enrollees. Healthcare providers, however, are not required by law to provide services to Medicaid enrollees. In its history, Medicaid has undergone various reforms aimed at providing access to the truly needy while combating fraud and enabling unnecessary dependency. One such reform, included in the Affordable Care Act, sought to cover the population that some lawmakers argued was neglected. This population was the adult population, individuals under the age of 65 with no children and an income rate up to 138% of the federal poverty level. Under the Affordable Care Act, states were not required by law to expand Medicaid, but 33 states, including the District of Columbia, chose to expand access and thus funding to the Medicaid program. This presentation aims to bring to light the issues that can arise regarding Medicaid eligibility and income sensitivity. For example, in a particular state, an individual adult under the age of 65 can have an income of 138% of the federal poverty level and be eligible for Medicaid services. What happens, however, if that individual adult qualifies for a raise at work and begins making 139% of the federal poverty level? A 1% increase in pay could disqualify him for the Medicaid program, yet that extra 1% raise will most likely not enable him to purchase a good private insurance plan. Thus, problems easily arise when an individual qualifies for a raise and suddenly makes slightly above 138% of the federal poverty level. Individuals are then faced with the decision to make more per hour, for example, and be kicked off of the Medicaid program and also unable to purchase private insurance, or to stay on the same level and maintain Medicaid coverage. People may feel forced to forego their instincts of bettering their work prospects because they cannot afford to make a little bit more per hour, because a small raise does not allow them to purchase a private insurance plan, a good private insurance plan, but forces them out of the Medicaid program. Many policy initiatives can be pursued to remedy this problem and make bettering one's life and work prospects desirable again. Two primary bioethical principles ought to be discussed in relation to reforming the Medicaid program. Firstly, the principle of solidarity, and secondly, the principle of subsidiarity. The principle of solidarity has to do with each individual's relationship to the other. The principle of solidarity teaches that man is by nature communal and that he understands his true identity not solely from himself as an individual creature, but in a relationship with the other, God and men. Thus, man cannot find fulfillment if he isolates himself from community. Solidarity is neither individualistic, collectivist, or communist, but recognizes man as a creature who is meant to live in community, by nature. Thus, what is objectively good for the individual is by necessity good for the community as a whole. The principle of solidarity is more than a vague philosophical principle or vague philosophical language. It recognizes that all people are connected regardless of their accidental traits. Thus, this principle is extremely important to discuss, especially in regard to the Medicaid program. As we are all inherently and mystically related, it is our duty to care for vulnerable populations. And in helping vulnerable populations, the individual, and thus the whole, will be aided in virtue and in necessities. Similarly, the principle of solidarity ought to be consulted when discussing reforms in the Medicaid program. In the spirit of solidarity, constructive reforms ought to be made to the Medicaid program that aid individuals in getting out of poverty instead of hindering this or unintentionally keeping them stagnant. Secondly, the principle of subsidiarity ought to be remembered when discussing the Medicaid program and any future reforms. The principle of subsidiarity teaches that the lowest level of authority or organization ought to deal with a given problem as they are closest to it. Thus, the Medicaid program ought to continue to give states the power to implement the program in the most useful way to that particular state, and in the way that benefits the population of that state the most. Each state has an understanding, a very intimate understanding of their own population and that population's problems and needs. This principle of subsidiarity understands that that state will understand these problems more than the structure of the federal government, as the federal government is farther away from that problem. The federal government cannot know what is best for each state's population as the state itself can know it for these reasons. As has been briefly demonstrated, both the principle of solidarity and the principle of subsidiarity are of extreme importance when discussing the Medicaid program. This is precisely because the program deals with human persons and organizations composed of human persons. When outlining the Medicaid program and any reforms for the Medicaid program, this understanding of the human person is extremely important. While discussing finances, fiscal policies is important and must be discussed, the human person ought not to be lost in those discussions, as the Medicaid program is for the sake of vulnerable populations. The following presentations will discuss the impact of Medicaid policy initiatives on individuals and local healthcare facilities.